Well, I'll start by talking about the skeleton, its functions, its types, and some curiosities. The human skeleton is a structure that performs several essential functions for the body. Firstly, it provides structural support, allowing us to stand and move. In addition, there are vital organs such as the brain, inside the skull, and the heart and lungs, inside the rib cage. The skeleton also serves as an attachment point for muscles, allowing movement and storing important minerals, such as calcium and phosphorus, which are released into the blood as needed. There are different types of bones in our skeleton. Long bones, like the femur, are located in the legs and arms and are essential for movement. Short bones, like those found in wrists and ankles, provide stability in some movement. Flat bones, like those of the skull, protect internal organs, and irregular bones, like the vertebrae, protect the spinal cord and support the body. Here are some interesting facts about bones. The first one is that the adult human skeleton has 206 bones, but newborns have around 270. This happens because, as we grow, some bones fuse, resulting in the final count of 206. Another interesting fact about bones is about the smallest and the largest bone in the body. Our smallest bone is the stapes, located in the middle ear and measuring about 3 mm, while our largest bone is the femur, which can measure up to 50 centimeters in adults.
The growth and maintenance of bones depend on three main types of cells: osteoblasts, osteoclasts, and osteocytes. First, we have osteoblasts. They are like builders of the bones. They produce the bone matrix, which is a primarily composed of collagen, and then mineralize this matrix with calcium and phosphorus, forming the hard bone. They are essential for bone growth and healing. Next, we have osteoclasts. Imagine they as demolishers. They break down old or damaged bone tissue, releasing minerals back into the blood. This process of bone resorption is crucial for bone remodeling and maintaining calcium levels in the body. Lastly, there are osteocytes, which are mature osteoblasts that have become trapped in the bone matrix they created. They live within small cavities called lacunae. Osteocytes act as sensory, regulating the activity of osteoblasts and osteoclasts based on the bone's needs, helping to maintain the structural integrity of skeleton.
I will start talking about osteomyelitis. Osteomyelitis is a bone infection that can be caused by various types of microorganisms, most frequently by bacteria. This infection can arise when germs enter our bone through the bloodstream from an infection in another part of the body, or alternatively through a bone injury or surgery. There's the stimulus of existing in two main forms: acute, which occurs quickly and is generally easier to treat, and chronic, which can develop more slowly and be harder to treat due to the formation of the area of necrotic bone. Osteomyelitis can affect any bone in the body, but it is most common in the long bones of the legs and arms in children, and in the spine in adults. The infection can compromise bone health, harming the structure and function of the affected bone. If not treated properly, it can lead to serious complications, including bone destruction and the spread of infection to other parts of the body.
Osteomyelitis is an infection of the bone that can cause various symptoms. The most common signs include intense pain in the affected area, swelling, redness, and a feeling of warmth on the skin over the infected bone. There may also be fever, general malaise, and fatigue. In more severe cases, the person may experience a loss of function in the affected area.
Certain groups of people are at a higher risk of developing osteomyelitis due to specific factors. One of the main risk groups are children, especially those who are growing. In children, the infection usually affects the long bones of the legs and arms, as these bones are in a rapid growth phase, making them more susceptible to infections. Older adults are also at increased risk for osteomyelitis, due to the weakening of the immune system with aging, and a higher likelihood of having chronic conditions. or diseases that can compromise blood circulation, such as diabetes and atherosclerosis. People with diabetes are particularly vulnerable, especially if they have a foot wound or ulcer that can allow bacteria to enter the bone. People with diabetes have circulation issues that can hinder the body's ability to fight infections, thus increasing the risk of osteomyelitis. Another group of people at risk are those with compromised immune systems, such as those with AIDS, HIV, or cancer, or those undergoing immunosuppressive treatment are also at higher risk. These individuals have a reduced ability to fight infections, which can allow an infection to establish and spread to the bones. Patients who have undergone bone surgeries or orthopedic procedures, or who have metal implants, are at risk due to potential contamination during the procedure. Additionally, people who have suffered open fractures, where the bone breaks through the skin, are at increased risk of osteomyelitis, as the injury provides a direct entry point for bacteria.
The diagnosis of osteomyelitis involves several essential steps. Initially, the doctor conducts a detailed clinical evaluation, considering symptoms such as pain, swelling, redness, and fever. Blood tests are used to detect signs of infection, such as an increase in the white blood cells and inflammatory markers. For a more precise analysis, imaging exams are fundamental. X-rays can show bone changes in advanced stages, while magnetic resonance imaging and computed tomography provide detailed images, detecting the infection earlier. Bone scintigraphy can also be used to identify areas of infection. Additionally, cultures of blood, fluid, or bone tissue are performed to identify the microorganism causing the infection. In some cases, a bone biopsy is necessary to confirm the diagnosis and guide treatment. By combining these methods, doctors can accurately diagnose osteomyelitis and determine the best therapeutic approach.
The clinical treatment of osteomyelitis is essential to eradicate the infection and prevent serious complications. The main treatment involves antibiotics, which are chosen based on the type of microorganism causing the infection. Initially, antibiotics are administered intravenously daily, usually for several weeks, to ensure adequate levels of the medication reach the infected bone. Later, it may be necessary to continue treatment with oral antibiotics for several weeks or even months. In some cases, where the infection does not respond well to antibiotic treatment, or where the affected area is not cured, a surgical approach may be necessary. Surgery may include the removal of infected bone tissue, or a drainage of abscesses and cleaning of the infected area. In some cases, it may be necessary to remove any foreign material, such as prostheses or pins, that may be contributing to the infection. In some more severe situations, it may be necessary to perform a bone graft to replace damaged or lost bone. This procedure involves using bones from another part of the patient's body or a donor's to help restore the structural integrity of the affected bone. Additionally, mobility is an important part of the treatment. Physical therapy is recommended to help recover function and strength of the affected leg. Regular follow-up with imaging and laboratory tests is crucial to monitor the response to treatment and adjust therapy as needed.
Although no tip can completely guarantee the prevention of the disease, there is a significant reduction in risks. The precautions that should be taken include taking care of and maintaining the hygiene of wounds, consulting a doctor when identifying frequent injuries or pains, taking safety measures when playing sports, keeping the skin clear and moisturized, and especially taking extra care if you have diabetes.